friends. Welcome to the Ancient Health Podcast, where East meets West. I'm your host, Dr. Chris Motley. Today, we are going to talk about bacterial infections, those hidden invaders that make their way inside the intestinal area, but also infect the urinary tract system, the kidneys and the bladder. And the common denominator that most people would have when we're looking at two main bacterial infections, but we can talk about others accompanying them, is E. coli and Salmonella. Now, if you've ever had a bout with E. coli or Salmonella, it's often associated with food poisoning. So in this podcast, we want to talk about your health history. Do you remember a time where you had food poisoning? Even if it wasn't diagnosed, do you remember a time where you felt so sick in your stomach, you felt nausea, you felt bloated, you felt like you literally had all the symptoms, such as bloody stools, chronic cramping, any type of diarrhea that has any type of foam in it, kidney issues, which you could have urinary tract infections, UTIs. These are all together when we talk about E. coli and its associated bacterial infections. Vomiting. Do you have any type of nausea where you don't feel like you're wanting to eat? Now, if you have these and you remembered a time where you had food poisoning, you can recall it in your brain. You remember the time when it stirred all those symptoms up and you said, man, I felt like I was dying. I've had patients that would tell me that I felt like I was dying right after I ate such and such. And it took them a few days to get rid of it, to get over it. But you'll hear me say this before, and I'll keep saying it again. If you didn't actively go into your herbal or even Western medicine repertoire to try to clean up those infections, yes, you may have taken antibiotics to help clean it up, but you have to make sure that you clean out the digestive tract, the urinary tract infection area, and really it is important to clean out the lymph. If you didn't really actively go after those infections to really eliminate them, they will basically spread and grow very rapidly after the onset of the infection. And what they do is they like to hide in the tissue. They like to hide in the red blood cells. They like to hide in the tissue. And so they'll do everything they can do to escape. So again, this is not to be negative. What I want you to do is that old food poisoning, remember this, old food poisoning, when it's not completely cleansed out or effectively cleared out of the system, can return and cause havoc and mayhem years later, many years later. So infections that have occurred in the digestive tract or the urinary system can hide, can become dormant, can do their best to evade by creating mucus or some type of plaque known as biofilms. They will do their best to try to evade your immune system and hang out in certain organs, depending on which organ is the most weak in your system. So the infections can stay dormant and they can evade for, I've seen years. I've had individuals that have shown symptoms and urinalysis and some blood work that have had E. coli, and they had it when they were in their teenager years, even when they're in their 40s to 50s. Now, I see patients with this many times in my office, and one of the arguments would be, well, did they not just get it again? More than likely, no, unless they went to a restaurant or someplace where it was like known that there was, hundreds of people who got sick after eating a certain type of food at a restaurant. I could see that. But more than likely, most individuals who had any type of food poisoning will remember the day and the event where it happened, of course, where they got food poisoning, they got sick. But if you get regularly sick after that particular moment, I want you to look back in your history and go, you know what, after I got sick with food poisoning, that was the time when I started to feel like I was going downhill. And I want you to know, just because you label E. coli as food poisoning, Salmonella as food poisoning, oh, it's just a quick stomach bug. No, it's not. In fact, E. coli can have very dangerous strains. They say that on the average, that there are 250,000 or 270,000 reported cases of E. coli in the nation. And I think that's a low estimate. But when we look at it, we often think that an antibiotic, when you go to the doctor, will take care of it. But the ramifications for E. coli is this. E. coli in itself is not exactly horrible. So I wanted to make a side note of that. Certain European countries use certain strains of E. coli as beneficial for the body, for the gut microflora. That's shown in many of the research out there. But if you have an E. coli or Salmonella that's left unhindered, where there's nothing to like offset it, like taking an herbal formula or doing things to clean it out, it can grow and rapidly multiply. They say that even Salmonella, as little as 10 cells of Salmonella, can literally grow into a full-blown infection state, or the whole body gets contaminated. Some of the main things are contaminated food or water, undercooked beef or raw produce, animal type contact when you're in petting farms or in the farms themselves. You can get it from animals. Swimming in contaminated water. You've seen me talk about that. If somebody's swimming in a lake or in a river that's tainted and it gets in their mouth or their ears or their eyes and their nose, that can create an infection state where salmonella can get into the body in that way, because there's some salmonella in fish. So it's a bacterial infection. So I want us all not to be afraid of it. I just wanted us to look at it and go, it is salmonella that can come through these types of transmission. And so when people say, well, where did I get it? You could have got it from swimming in a lake or a river or in a body of water. You could have got it from somebody else, because it can be from person to person. You could have got it from undercooked chicken or eggs. How many individuals out there right now eat eggs that are over easy? I'm not putting them down. Some people say, I love the yolk. I love raw eggs. There are some individuals who will never eat them because they say there's a lot of Epstein-Barr virus, a lot of herpetic viruses within the yolk of chicken eggs. Some individuals state that. I've never checked every single egg yolk out with testing. But when we talk about eating raw eggs, if it's not cooked properly, there is a possibility of certain bacteria that can thrive in there. Salmonella. And E. coli can be in the same way. It can contaminate and be in the water system. It can be in other people, undercooked food. And it's just opportunistic bacteria. Now, one of the main signals I think we all need to make sure, like when we're talking about salmonella, is arthritic pain. Joint pain is a very big indicator when salmonella is running free and rampant with all the digestive issues. E. coli, when you've had an infection from E. coli, remember any type of food poisoning, that usually will not only give you extra joint pain, but if E. coli is involved, it usually goes to the UTI. So I hope I make this straight. If you had food poisoning and it made you have arthritic pain in the joints, I would very much suggest you go get checked for salmonella. If you had food poisoning and you had UTIs or urinary bladder issues, kidney issues, I would go get checked for E. coli. Now, you would ask, how would I check for it? Now, write this down. I like to use labs like MicroGen, MicroGenDx, MicroGenDx. They have different tests. One's called a Urokey, like a urinalysis key. They even have tests that go into saliva, stool, reproductive fluids, basically synovial fluid, joint fluid. They will test even ear, eyes, nose, and throat type fluids to find out if there's infections going on, even in the bloodstream. I would say if you've ever had an old infection from food poisoning and you have chronic UTIs now, I am telling you, you need to go get a Urokey, a urinalysis key, either from male or females, because what happens in the body, if you guys will watch here, is as that infection is in your digestive tract causing the diarrhea and the cramping, you're throwing up and you're having diarrhea at the same time, those infections get into the arterial system, the circulatory system, through the liver, through the gallbladder, around the spleen, around the pancreas. They'll make their way down into the colon and into the kidneys. The infections spread through many of our arterial system. that in case, as it starts to spread, you're going to start having all these different symptomatology only because the infection is spreading in that manner. It'll go into the kidneys. So what started off as something that was in the colon area and then even the small intestine has now spread to the kidneys via the bloodstream and your body's attempt to try to clean it out. So when you get a Urokey, you're going to check for over 50,000 different types of bacterial infections and see which one is hanging around. So you can definitely go ahead and get a heads up if you've known you've had E. coli in the past and you're still fighting those chronic infections as time progresses on. And then if you know you ate any type of chicken or eggs or undercooked food and you started to notice that, man, I got sick really bad. Maybe you did know you got salmonella. Oh, I got salmonella poisoning when I was 22. If you took some antibiotics and maybe that helped clean out a lot of it, but you're starting to have digestive issues after that, you're starting to have joint pain, I pretty much believe that salmonella is still hanging around. So then I wouldn't necessarily go get a synovial synovial draw. You could get it. You can check out which infection's in the joint because it's very, very valid. But I would definitely get deeper blood work done for the bacteria and see if that lab would look into salmonella. They do like where there is a physician's referral. So I'm going to have a referral key. I'm going to try to talk to them about having my referral code so you can get this testing done. I got to make sure that that's online with them because they're such a great lab. But the key for this podcast is for us to become aware and realize that even when we think something is so light and so docile as these types of infections, that's what we usually normally think about them. Like, oh, they're just a small thing. No, they can create chronic infections because of the rapid rate in which they grow. So I've had patients, 2 of them come to mind, and I want you guys to listen to this. They had horrible food poisoning. I literally had a patient tell me that they would experience food poisoning at least 6 times in a short, I think it was 7 to 8 month time frame. They believe that they got food poisoning within that time frame. In my opinion, no. I would suspect they probably got food poisoning from one area or from something or somebody or one of those main sources we talked about, but it just kept getting reignited because it desensitizes and injures your immune system so bad when you get that first bout of it that then you have histamine in the blood, you have inflammatory agents in the blood. And now any other little infection, whether it comes from a mosquito or a tick, or if you get some kind of other parasite, it's going to make this system go into full-blown inflammation. So you always say, I want to get to the root cause. I believe that too. But if you've had infection states, like we're talking about, the food poisoning, getting a Urokey from MicroGen or getting a blood test to see if there's any salmonella or any related infection from food poisoning is very key because they're not going to test that in a normal Western medicine setting. No knock against the Western medicine world. I am saying that you'd have to go to a chronic disease or disease control center doctor to see if there's any type of rampant infection going on in the body. They won't look into infections. They think everything's chemical. Like, oh, you have this chemical imbalance in your blood. It's white blood cells. We really don't know why your white blood cells are going crazy and your red blood cells. Well, I can pretty much tell you it's because there's infections within the system. So when you start to put the pieces together, I want you to remember food poisoning, kidney infections or bladder, E. coli, food poisoning, joint pain, possibly salmonella. Don't let your investigation stop there. When you get a Urokey, when you get a blood test, you don't have to get both of them. Maybe just try one of them. I want you to investigate and see which bacteria is rampant in the system. It could be strep. It could be staph. You could have gotten an E. coli infection from food poisoning, and you could have already had strep or staph in your system, and that just pushed you over the edge. Your body was trying to get rid of the strep, and many of you out there are saying, yes, that's what happened. I've had strep since I was a kid. Nod your head with me. You're like, yes, I've had strep inside my throat, inside my tonsils, in my sinus gland, always having drainage and things like that. Even my throat feels clogged, even as I got older, right? your body's trying to handle that. And then you remember a time that you could have ate something. You're like, man, I ate something and it just tore me up. So usually strep, sometimes staph will go dormant. Your body gets used to it. You kind of handle it. And then you get this E. coli, and the E. coli is horrible because it can spread and give you that. And then you start to subside in your symptoms. But that weakens you to where that old strep will come out and spread. So that's why I think it's important when you get testing that you can test for over, 50,000 different types of strands. What if you don't find all the strands? Maybe you only find one or two. That's great. And if you're a person who likes Western medicine ways, then you can try to find the antibiotic that would actually go and kill this infection. If you're on the side of doing more herbals, I like some good standard herbals that are for E. coli. To me, there are 3, but there are many good herbs out there. I want you guys to write this down. There are many good herbs that will help if you had E. coli or Salmonella. But I'm going over the heavy hitters, okay? If we're going to go after either one of them, let's go generally. Chinese coptis, always known as golden thread. Golden thread supreme from Supreme Nutrition Products is amazing. You can take one of those capsules 2 times a day if you're full-blown adult, but for children, I always say ask the primary care doctor's opinion, thoughts, but you'd have to reduce for a child. I love golden thread. Golden thread will not only help clean up infections, like it's an antimicrobial. It's like antibiotic for Chinese medicine. It also helps clean up the gallbladder and the liver. It will help flush the digestive tract. See if you resonate with that one when you look. The second one I really like for E. coli, and I do like for Salmonella, is one known as Noni, N-O-N-I, but we call it Morinda Supreme, from Supreme. And it is so good at cleaning the infections out of the digestive tract. Truly love those 2, Golden Thread Supreme or Morinda Supreme, because they really get into the digestive tract. Another one I really like to go into the UTIs and clean out, generally like the kidneys, is Uva Ursi. So I will look into general infection cleansers like the Golden Thread or the Morinda. Sometimes I'll look into neem, N-E-E-M. It's great. It's a good Ayurvedic herb that kill everything. But I also will love to add in anything that would help clean out the kidneys as well. So you could look at Uva Ursi, U-V-A-U-R-S-I. So if you're out there, Uva, like University of Virginia, Uva Ursi. That's a great kidney gallbladder stone cleanser. It'll strengthen the kidneys. You start strengthening the kidneys and you want to start cleaning out the infections, you will feel in your body, your kidney flanks are probably sore. Your digestive area below your belly button could be bloated or tender, and you feeling around saying it is so tight and tender. It's when I urinate, it's dark brown. It has a different color. It has a different odor. I literally feel like I smell in the southern areas of my body. Yeah, the kidney flank pains we discussed. Your legs feel swollen. Your internal knees are sore. Your calves are tight. Your gastrocs, your calf muscles are always tight, and your heels hurt, right? So when you guys are listening out there, I know what you guys are like, what you're going through, because I've had it. That's what E. coli can do. And all those things I just mentioned to you are all kidney symptoms in Chinese medicine. So you have that infection. So whenever you have these bloating, you want to take that Uva Ursi to start to strengthen up the kidney, but also help it to flush properly. And then when you do the Golden Thread or the Morinda, you're going to help knock loose a lot of the mucus and the plaquing in the gut that's caused by the infections and that leaky guts. But you don't want to kill it off too quickly, because what will happen is you'll flush too quickly and your kidneys can't take the whole load, and then you start feeling worse. So some people want to go gung-ho, and they'll say, well, I'll take one of these, 3 times a day of each. No, I usually say take one a day of each for a week and see if your body can handle it, and then make your way up to 1 in the morning and 1 at night. You can use it as the ball is directed. It's based on a 150-pound person, but you don't want it to get to where it makes you herx. So if you feel like you're actually getting sick by taking them, like you're getting worse, you feel like I'm getting worse when I take this, I'm not feeling good at all, then you need to back off. You know you're hitting the nail on the head, though, when you start to flush all this bacteria out of your system. Because as you start to flush and knock loose, your kidneys are going to try to capture, and so is your colon. So you have to make sure, as you use either any one of these three, that you're going to want to keep your colon and your kidneys pathways open. So what I always suggest for the colon to stay cleansed and a colon cleanse is to look at the large intestine 11 points. And they're right here on the, basically on the radial, near the radial head of your forearm joint. So large intestine 11, if you rub this point out, right, if you reach in, and many of you guys out there don't do this while you're driving, I always make that suggestion, but if you look at your arm and you bend your arm, the crease, the top of the crease right here, and you reach in and there's that bone, that large bone right there, and you feel along that radial head, it's called the radial head, it's like the big knobby area of that joint. Here's the crease, and you press in. You guys follow me right there. You're going to feel tenderness all through that area, okay? I want you to rub all through that area down the forearm bone. You do that on both sides, 30 to 40 seconds at a time. And you rub those points out, you will start having healthier bowel movements. You can even rub large intestine 4, which is right here in the web. So large intestine 11, the area of large intestine 11, and large intestine 4 area. 30 to 40 seconds, twice a day. You will start to see your constipation symptoms starting to fade. You're giving energy to the colon. You'll start flushing that way. So the E. coli and Salmonella will start to be pushed out. The next part is the kidney. Now, one thing I really do like with the kidney is that some of the most effective points for the kidney is going to be the legs. The kidney meridian, if you can see, you can't see it that well. It runs right here back on the back side of the calf, on the inside of the knee, all the way up the inside of the thighs, through the pubic bone area up into the area of the heart, up to kidney 27. But you have to remember, it's on almost the back side of this kidney. So what I do is I always reach on the back of the shin bone. Here's a shin bone. On that back edge of the shin bone, I go up and I try to hit the kidney points, kidney 6 and 7, 8, and even in the calf. If you rub those calf points and those leg points of the kidney meridian out, just reach in there while you're sitting down at when you're watching TV or resting, and you dig in and maybe take some lavender oil or some kind of aloe vera and just don't hurt yourself, but press into those areas. You'll start flushing your kidneys. You can use the large intestine points, the kidney 6, 7, 8. You don't have to do all of them, but find those points. Even looking on any type of acupuncture points or acupuncture guide I have here at the office, you start rubbing those points out, you're going to find the ones that are tender all the time. And you go, that one was tender yesterday. Now, don't rub the point out to where it hurts and it's just making you feel sick. You just want to do it 30 seconds, 2 to 3 times a day. That's about all you want to do. You're trying to set up your body that as you clean up, you're getting your colon and your kidneys so clean that you're going to consistently flush the E. coli and the Salmonella. Your bloating's starting to go away. You start taking the herbs, those simple herbs, and then what you do is you start to flush them out. Now, you need to research on Supreme Nutrition products. There's many different types of herbs that kill off E. coli or Salmonella, and maybe you do want to go the Western medicine route. If you find it through this testing, you could show it to your doctor and say, Doc, I have these bacteria they tested. I need something for it. But some people take things in adjunct and as an adjunct to their antibiotics, such as golden thread or Morinda. I do it all the time with my patients, and they do tremendously well with it. So you can use those to clean out, and you can start to notice that kidney functioning gets better. Your kidney color gets clearer. The smell gets better. the legs stop hurting, the knees stop hurting, the hip flexors stop being so tight. Your back will start feeling better because you're getting rid of low-grade infection. The catch in your throat will start to go away because that's a kidney issue, the dry throat. And your colon will start to flush. That means, what is this colon signs? Your abdomen stops being tight. It starts feeling a little bit more relaxed. The tightness around your throat, even sinus congestions associated with the large intestine, that will start to drain too. You'll start noticing that you have more strength in your hamstrings and your glute muscles. You won't feel unstable in your pelvic region. That's all large intestine. So if you've had large intestine issues and you've had those kind of symptoms, like, man, my abdomen always is tired, I can't keep my core strong, my glute muscles, my butt muscles, my hamstrings are always so weak, they're always sore. Literally, those are huge signs for large intestine. And so you want to rub the points I talked about, stimulate those points, clean them out. Now, all that to say is, as we're going through this, I know it seems very, just very, simple and plain, but that's the truth of it. The reason I think this is so important, and I know it's important, is because there are so many patients that have come into my office that have had food poisoning, and they did not realize that they were chronically sick after that event. They'll trace it back and finally realize that, yes, I was really sick after the chronic infections of, the food poisoning. But they are always taught like it's not a big deal. I do believe that we can stay tough and we got to stay strong and, we bounce back from those infections. But depending on how much the water that went up your nose, or if you swam in a lake that was heavily infected with certain parasites or bacteria, if you ate fish that had a whole bunch of bacteria in it, if you went to a restaurant that had contaminated foods, you don't know how much was in there. And they can grow very rapidly. So the issue to me is that we want to find those hidden invaders, because if the infections of the hidden invaders, for instance, the E. coli takes over the digestive system, takes over the kidneys, many times, they don't say viruses are going to take over, but viral load can change as well. So viruses can come into play. This is just an example. Why? Because your cells will get sick. And your cells are going to try to do what? Autophagy. They're going to try to recycle themselves. But if you're too tired, your cells will not recycle properly. Does that make sense? You get sick and your cells are too tired to recycle after they've been damaged. So at times, your body will allow other infections to come into play to help you clean out your cells, i.e. viral. That's one angle. So this always makes me look into the heavy viral load of the system. And I'm not going to switch gears too heavy. I just want you to know that there could be viruses like Epstein-Barr virus, cytomegalovirus involved in these areas. And that's true. But the first step is to identify the bacteria. And know this, the golden thread and the morinda, those have antiviral qualities to them. So as we start to wrap this up, when you start cleaning this out, taking these herbs, and you start to identify them through these testing through MicroGenDx, once you start cleaning out and you still feel like, man, there's still a little bit more I need to do, then I would definitely go get checked for all the herpetic viruses. Not saying it's like herpes, like STD in that arena. I'm talking about everybody has herpes viruses of some sort, and there's different types. And it's very important that you find out if you've had food poisoning, if there's any type of herpetic viruses within the tissue. Then you can talk to your doctor about taking something like acyclovir or something that's antiviral in the herbal remedies like the astragalus or olive leaf or elderberry. Those are big things, but those will help you out of your chronic sickness. And maybe that's the follow-up to this. We're going to talk about, like, if you did have the chronic infections like E. coli or Salmonella, like what are some of the viral loads that you want to look into afterwards. So I'll have my producer write that down. Now, this, as this stuff starts to clean out, remember, I do like to use far and near and far infrared saunas. I do full spectrum. I like that. I use Sunlighten. Sunlighten is great. They have a really good sauna. Some people use Therasage, depending on what system and how much you want to spend. I do like that. I like lasers like Avant lasers. You see me with this Avant laser. I also have True Lasers by Dr. Richard Amy. Dr. Richard Amy has a really great laser. If you want to check out his work, Dr. Richard Amy has True Lasers is really great laser therapy to help put over the kidneys, to help put over the colon, to put over areas where they're infected. So you have the infrared and you have lasers. His laser's around $1,300 to $1,500, I believe. It's really reasonable. It's a really great laser. And I love hydrogen or oxygen therapy, whether it's with the water you drink that has hydrogen or oxygen, really saturated in there. But you could get where you're taking hydrogen or oxygen baths, or you can use hydrogen water capsules, hydrogen capsules for water. And you start using those things, maybe a hyperbaric chamber. Those are really important to help the oxygen get in the system and help clean the system. So you can have that therapy, and you can also have colonics or coffee enemas. Those are some really simple ways, like the saunas, laser, coffee enemas, or colonics. Some type of hydrogen or oxygen enriched water. Whether you drink it or bathe in it, you need something to go into the tissue to help release and clean that stuff out. These are simple steps. If you're going to go to a practitioner, I always say I would find a good Chinese medicine practitioner that really knows their stuff on the kidneys and food poisoning. Find a Chinese medicine practitioner that's really in touch with working with hidden infections. And you're going to find a good practitioner, and they're going to get you fixed up. So we're going to have that in the notes. I don't want this podcast to be all over the place. I'm going to probably label this like, have you had food poisoning? Food poisoning is nothing to bat an eye at. It can be pretty serious. So if you know that if you've had it, or somebody you love, or somebody's had bouts with it, and you still felt sick, I would get those infections checked out. E. coli, Salmonella, or anything related to it. We can shoot a video in a week or so about some of the viral load that I would really look into as well, and what you could do for that. All right, guys, I hope that was a good episode for you. Yes, for the Ancient Health Podcast. I love looking for hidden invaders. I never take these things for granted. When a patient comes in and they just gave me the information that I gave you, I do not take it for granted. Never take it for granted. Food poisoning. All right. So, guys, from all of us here at the Ancient Health Podcast, if you love this stuff, please like and subscribe. Send it to somebody who has chronic food poisoning or chronic digestive issues or chronic UTIs. And, if you are wanting to know when these new episodes come out, just keep hitting the bell where it notifies you. Put on the notifications where it comes up for you. I also do on my live Q&As on my membership, usually the week after we post a certain podcast, we try to answer the questions on the Q&A. So the members come in and they ask me even deeper questions about UTIs or bladder infections, kidney infections, food poisoning. All right, guys, I hope this was informative. I appreciate all of you. And from all of us here at the Ancient Health Podcast, I'm Dr. Chris Motley. Until next time, talk soon.